All right, let's listen.
Well, good afternoon. I just wanted today to update folks on our progress around vaccinations and give you an update of where we believe we are vis-a-vis what you're hearing in some of the national media and some of the assertions have been made by a number of organizations, individuals, elected officials, and the like, and give you a sense of where we believe we are and how we can make sure we distribute our vaccines and our protocols in efficacious way, in a way that guarantees your health and safety. Just to give you a perspective, California has formally advanced a partnership with the federal government where 1 in 5 jurisdictions, California is 1 of 5 jurisdictions in the United States, have been doing what we refer to internally as micro-planning, but advanced planning for vaccine distributions. We've done this in partnership with the CDC and the DOD. That's been underway for now a number of months here in the state of California, this formal role, this formal partnership. As it relates to the efforts, we have long been in the vaccination business. Our experience in mass vaccinations makes us a unique partner for the CDC and the DOD based on the scale and scope of the vaccinations that occur on an annual basis here in typical due course here in the state of California. Just consider 19 million annual flu shots typically distributed here in the state of California. Our experience back in 2009 around the distribution of vaccinations and other therapeutics related to H1N1, the work we've done historically with hepatitis A, and of course our childhood vaccination protocols. Well-established partners at the grassroots level, well-established protocols, information gathering, confidentiality agreements, and the like. Just giving you a sense that the experience with vaccinations is well established here in the state of California. And so as we work to advance the protocols and partnerships, as we advance our formal planning and engagement with the CDC and the DOD and others, we do so on the basis of the architecture of a framework that has been well established for many, many years here in the state of California. Recently, we put together more formally a vaccine steering committee. In fact, in April, the vaccine steering committee was put in play within the state of California, CDPH, Department of Public Health. We now have advanced a logistics task force working here at the Office of Emergency Service. For the last few months, they have been coordinating with federal, regional, local partners to look at logistics side of how we implement and actualize our vaccine plan. California today is launching now more formally a scientific safety review, a work group of 11 individuals, experts in their field. These are top health experts that will independently review any FDA-approved vaccines. Question I often get is, are you going to take someone's word for it as it relates to vaccines? Of course, we don't take anyone's word for it. We will do our own independently reviewed process with our world-class experts that just happen to live here in the state of California, treasure trove of experts from UCLA, UCSD, San Diego, from partners that we're able with actual experience in epidemiology from Stanford University, people from UC Berkeley, others that represent county and state health offices, all part and parcel of an independent group of health experts that will help us advance and closely monitor our protocols and procedures related to vaccine trials. Let me just give you a sense here. You can see this slide of some of their expertise in biostatistics, in epidemiology, in pediatric infectious diseases, in health equity, healthcare financing. Again, the spectrum of expertise, a diversity of expertise, as well as a geographic diversity. And when we talk, by the way, of health equity, that's a frame of cultural competency. That's a big part of our commitment here in the state of California, the proper distribution of resources, particularly as it relates to vaccines and focusing on immunizations. So that's broad strokes of the group that we're formally convening here in the state. We're very proud of the work that's been done by Dr. Gowling and his team to identify these experts, and these experts, again, will independently review and monitor any vaccine trials to guarantee the safety, to guarantee the equity, and to guarantee the transparency of the distribution of our vaccines. For just full disclosure, the transparency was put forward through guiding principles that we put out in a document, a vaccine plan that we submitted to the CDC last week. In return for submitting the vaccine plan, the state was afforded some $28.86 million of federal support that we will utilize with our partners here throughout California, meaning that almost $29 million will go to support our efforts at the state level and also support local efforts in terms of advancing our vaccine planning efforts. Bottom line, though, is the first phases of vaccine will likely be limited in terms of availability. Questions abound. When do we anticipate or expect the first vaccines to be made available? There are some audacious stretch goals that you've been hearing that have been advanced out of Washington, D.C. Those stretch goals have been organized around two companies in particular that are asserting the availability of very limited supply of vaccines as early as November and December of this year. We have different protocols, processes, and procedures related to each company and their vaccines. They require different storage. They require different distribution strategies and plans. It gives you a sense that as every company comes forward, these happen to be from the CDC's assertion, the two companies that are leading in this space as it relates to the prospect of early limited availability, Moderna and Pfizer, that the number of vaccines will be very, very limited and require a protocol and a process of distribution focusing first on our essential healthcare workforce and our first responders. Accordingly, the limited first phase supply, and I'll in a moment give you a sense of what I mean by limited, also focuses on high-risk groups. Clearly, those 65 and over, those in skilled nursing facilities, long-term care facilities throughout the state, not only skilled nursing facilities, but residential care facilities, those with disabilities, those that are detained or otherwise incarcerated, and obviously those that are often underserved, that have become higher risk from an equity lens, issues related to racial minorities in the state of California, particularly the Latino community, African American community, and never do we forget our rural communities in the state that often are neglected as it relates to the distribution of immunization strategies and vaccines. In this case, they're front and center in terms of our planning. The bottom line, though, with any appropriate vaccination plan is addressing some of the logistical challenges that we've come to long recognize as it relates to the challenges that have been imposed around COVID-19 transmission from the beginning, be it PPE, issues associated with testing and contact tracing, no different as it relates to a vaccine plan, sort of getting under the hood and really looking at where the challenges may lie. Let's start with supplies related to the distribution. Right now, that supply needs include needles and syringes, alcohol, pads, bandages, masks, PPE related to the distribution and the application of the vaccine itself. Just put it in perspective, with H1N1, you didn't necessarily have the same asymptomatic issues that you will have as it relates to COVID. And as a consequence, many people may be asymptomatic, and we'll need to protect those that are distributing these vaccines with the appropriate masks and face coverings, with the appropriate PPE. It adds another layer of challenges. Relates to challenges, the issue of storage requirements. I mentioned storage a moment ago related to Pfizer and Moderna. Both Pfizer and Moderna that are talking about X number of millions of available vaccines for the United States in total. And by the way, our internal documents, just to give you a perspective, and this is full transparency, and by no means, I don't want people to run with this number, but for planning purposes, we were provided an estimate. And this was just an estimate. This is the high end, just to put in perspective, the high end estimate for planning purposes for vaccination A, vaccination B, both Pfizer and Moderna. The cumulative, the total number of vaccinations for the nation for planning purposes on the high end through the end of the calendar year was about 45 million. Note that each vaccination needs to be used, each distribution of vaccination has to occur in a 21-day period. You have to actually have 2 shots, not 1. So from a logistics perspective, from a storage perspective, a requirement for notification, bringing people back after the first immunization shot, you could take that number, 45 million, cut it in half, and then take a percentage of any given state, including the state of California. You'll get a sense that on the high end, for a state like ours, it's 1.5 million, 2 million people tops. And we have roughly that many people just in our healthcare delivery system alone here in the state of California that will be prioritized. So if I haven't lost you, I want to just, again, remind you that when we talk about vaccinations, don't anticipate or expect that you can go down to a local pharmacy anytime in this calendar year and likely get a vaccination. We hope that's the case, but based upon all the evidence, all of the data that we have been provided and the expertise that we've been able to glean and advance ourselves in terms of the protocols that we have advanced with the CDC and the DOD as, again, one of 5 jurisdictions doing the micro planning. It is simply unrealistic to expect that these limited doses will be for a limited number of people, and we don't anticipate mass availability until 2021. The question for all of us is that in the first quarter, second, or third quarter of 2021? My answer to my own question is yes, yes, and yes. It just simply depends who you talk to.